Good day and Assalamualaikum. I am Zara Abdullah Manawindong, a nursing student at the Mesamin campus. Today's video, I will be assessing the cardiac and peripheral vessels. So the definition of it is the cardiovascular system is highly complex, consisting of the heart and closed system of blood vessels. So the purpose of it is to identify any sign of heart disease and initiate peripheral and treatment. So the equipments are stethoscope and gloves. So considerations before, during, and after the procedure. Interview self, verify client identity and explain the procedures. Perform hand hygiene and ask the client if he or she has any history of allergies. Provide for client privacy. So things to document after the procedure. Document all the findings, normal and abnormal response of the client to the procedure.
For central vessels, to palpate the carotid artery, lightly place your fingers just medial to the trachea and below the angle of jaw. The pulse should be regular rhythm and equal strength for both arteries. This is also to identify if palpable vibrations or thrills are present. Auscultate for vascular sounds over the carotid arteries. This is to determine for the presence of bruit. Inspect the internal and external jugular vein and determine for the type of pulsation it produces. The internal jugular vein has a softer, undulating pulsation. The vein normally protrudes when the patient is lying down and lies flat when he stands. Inspect and palpate the aortic and pulmonic areas. Note for any pulsation. This is to assess if there's any blowing or swishing or other sounds that must be heard. Inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. This is to identify if there are unusualities in the abdominal aorta and provide prompt nursing interventions. Place the client in a semi-Fowler's position. Auscultate the aortic, pulmonic, tricuspid, and apical area. Use both the bell and diaphragm of the stethoscope. This is to identify S1, S2, or adventitious heart sounds. For peripheral system, inspect the peripheral veins in the arms and legs. Note color, temperature, and any presence of edema. This is to determine if no edema or prominent venous patterning must be seen. Palpate the peripheral pulses, the temporal, radial, brachial, femoral, inguinal, popliteal, dorsalis pedis, and posterior tibial. Palpate the pulses on both sides of the body and systematically. This is to increase radial pulse volume, indicate a hyperkinetic state. Palpate or auscultate for the apical pulse. Amplitude is usually small. Assess the pulse for rate, rhythm, equality, amplitude, and elasticity. This is to diminish or absent pulse, suggest partial or complete arterial occlusion. Assess the peripheral leg veins for any signs of edema, varicositis, and phlebitis. Grade for biting edema as 1+, 2+, 3+, 4+ according to its depth. Bilateral edema indicates a systemic problem. Assess for arterial and venous insufficiency. This is to determine any indication or arterial insufficiency.